You are listening to the Uninformed States of America podcast with your host, Mike Riley, here on the Young Angels Network. Follow us by going to youngangelsnetwork.org, MikeRileyNow.com, and the USAPodcast.com. Yeah, all right now. Yes, indeed. And welcome, ladies and gentlemen, boys and girls, everything in between that, of course, to the Uninformed States of America podcast, the USA podcast, right here on the Young Angels Network. Welcome, one and all. Welcome to the show, man. What's going on? Yes, that is for you right there. Welcome to the USA podcast. I'm your host, of course, Mr. Mike Riley. Today is Wednesday, January the 20th of 2021. Happy Inauguration Day, everyone. We survived. We had a safe and beautiful inauguration. Lady Gaga stole the show with that golden bird. We're going to talk about all that, of course. I'm going to be talking about the inauguration and how we move forward in the post-Trump era in the second segment of the show. In the third segment of the show, I'm going to be giving you my opinion in the open mic about censorship in 2021 and all this about social media censorship. But before I move on to the first segment, which I'm going to be talking to you about here in a second, make sure if this is your first time hearing this that you log on to the USAPodcast.com. Follow me on social media. Please subscribe to the podcast if this is your first time listening to the podcast. Leave a review and all that kind of cool stuff. And also, did I say follow me on social media? Well, if I didn't, follow me on social media. Anyway, moving on with the time we have tonight. So last time we had a show, which was on January the 6th of 2021, we spoke to Dr. Catherine Fuller, and we spoke to her. She was a doctor that studies immunology. Good Lord, that's a word I can't say. And also respiratory illnesses. And we talked to her about the COVID vaccine. And there was a lot of good information given in that episode. So go back and check that out. And I want to continue this conversation about the COVID vaccine. So this week I spoke to Miss Anne Heiner. Anne is a physician's assistant who works at an urgent care clinic in rural Oregon. And I wanted to speak to her because she's one of the frontline workers who's dealing with this vaccine and dealing with this virus. And so I wanted to talk to her about what's going on with the vaccine with her and get an understanding for her from her perspective. So, ladies and gentlemen, with no further ado, this is my conversation with Anne Heiner, where we continue the COVID vaccine situation conversation. A lot of questions. Let me play it from the beginning, actually. All right. And welcome back. So, a lot of people have a lot of questions concerning this vaccine and concerning all the things that are going on. And I wanted to get some firsthand knowledge from someone who actually works closely within the medical field. So on the phone with me right now, I have a very special guest, Miss Anne Heiner, and she works as a physician's assistant. So this will be a really good conversation, a really good chance for us to get some insight. Anne, are you there?
I'm here.
Hey, Anne. How you doing? Thank you so much for joining us. That's for you. That's our digital studio audience there. So thank you so much for being here. A lot of my listeners and a lot of people have a lot of questions concerning what's going on with the vaccine and the virus itself, and to be able to get some answers or some firsthand knowledge from somebody, like I said, who works closely in the medical arena. I think will be a really, really good way for people to kind of get a better understanding. So thank you so much. So let me ask you, first of all, Anne, what got you involved in the healthcare industry? What made you want to do this?
Yeah, so I've been working as a physician assistant for the past 7 years. I guess my route to coming into the medical field wasn't terribly unique. Like a lot of people who end up in the medical field, started out with just like a interest in, like a fascination and respect for kind of the intricacies and just like the beauty of the human body, and like learning about that in like basic courses in school. And then as I just thought about what things I wanted to continue learning about, that seemed like a worth thing to continue learning about. And I did do some research, like in a clinical, like lab setting, and just kind of found, like in undergrad, I guess it wasn't clinical, it was just a research lab. That's what I meant to say. And, well, that was fascinating. I didn't really feel like that was where I wanted to stay. I wanted to like also apply that to in interactions with people and help them with their specific problems. So that's kind of, I guess, overall gist of what led me to medicine.
Yeah.
And yeah, I've been happy to be in that the past, like I said, 7 years.
Well, that's awesome. So you got into it because you wanted to be a healer, which is great. Now let me ask you, when it comes to COVID, you work in the medical industry. I'm sure you've had to witness some things firsthand when it comes to this virus. What are some of the things that you've had to witness firsthand with regards to this virus? How has it affected you personally?
Yeah. So I guess I'll just kind of explain my practice setting currently, or for the duration of the year since the whole pandemic started. I've been practicing in rural urgent care, and the first half of the year, actually, we really weren't seeing cases of it. I think being rural, we were a community that was like somewhat removed from where the virus was being seen in higher numbers and higher concentration. But the last several months, we've definitely been seeing a lot more cases pop up. So in the urgent care, I'm seeing mostly patients who are not terribly sick. Most of them are able to go home and manage their symptoms at home and quarantine there. But some of them do end up being more sick, and then I would kind of refer those ones on to the hospital or the emergency room. And so I guess I'm not like day in and day out with those who are quite sick from it. Right. But I definitely do see, I've been able to correlate, in a small town, you can kind of put the pieces together as various patients come in and tell you about their exposure, how they think they got it. And I have definitely seen, for instance, a dinner party that occurred a couple of weeks ago that led to multiple cases of it. So it's kind of interesting seeing now we've got like half a dozen cases in our small community that's very specifically linked to this one event that happened that was. So I guess that's
it seems like that, out here in LA where it's really, really bad right now. It seems like that's one of the ways that it continues to spread is, people keep having these get-togethers, these parties, these things that are happening. And it's creating this environment where I think the virus is finding so many hosts, and that's why people are trying to rush these vaccines out right now. And let me speaking of the vaccine, let me ask you about that. So the vaccines are coming out right now. Have you guys, where you work at your urgent care center, have you guys received vaccines yet?
Yeah, I did. I was really excited about that. I got news, I guess early December, that we likely would get it within the month. And then week of, I heard that we had received many doses of it. And so I got mine the day after Christmas. Oh,
so you got your vaccine?
My first dose.
You already received yours, or you received your first dose already?
Yep, I received the first dose of the Moderna vaccine.
You got the Moderna. So how do you feel? Are you haven't grown an extra limb or anything like that yet, have you? All right.
I haven't. So I felt absolutely great. The first probably 12 hours after, and then my arm started feeling sore, very expected. It was pretty sore, more sore than after my flu vaccines that I've gotten every year. But still, nothing shocking. And then I think I felt just a little bit chunky, I would say, not really crappy, not really sick, but kind of trending a little bit more towards like the I don't feel so good side of normal, but that's again like also not unexpected. That's actually a sign that my body's like doing what it should be doing with the vaccine. And yeah, that lasted maybe 2 days. And again, it was not anything like real severe. It was just like, I was probably also hyper paying attention to, hyper aware of like any symptoms. And so I do think that was a symptom that I had. And then I did have some redness and swelling come up at the injection site,
but that's all normal.
After.
Those are all normal things. That's all normal. Yeah. And like this shot, the vaccine for COVID isn't like getting like a flu shot vaccine, right? I mean, before you sit down and get it, there's a whole lot of things that the person who's administering the shot, there's a few things that they have to go over with you. I mean, it's not just like a sit down, you get the shot process. I know when like my mom and all them used to get their flu shots back in the day, they'd go into, CVS or whatever, you get the shot and then you get out. Getting the COVID vaccine isn't quite like that same process. There's a whole lot of things. I mean, you have to go over the side effects with people. You have to let people know what, how it's going to react to their body. Is that pretty much how the process goes?
I mean, I guess it was actually pretty quick in that for me. I did receive a packet of information about the specific Moderna vaccine, and then also like some info to connect with like an app that the CDC kind of the app enables me to like report my symptoms to the CDC, so they can kind of keep a database and tap on side effects that people are having and any concern.
Right. So let me ask you this. Sorry, I didn't mean to cut you off. But I do want to ask you, what are some of the, working in the healthcare industry, and like you said, in kind of like a rural town up there, like where you work, I'm sure you're hearing a lot of people maybe say things with regards to the vaccine. What are some of these claims that you are hearing regarding the vaccine from people that you're coming across, and what are some of the things that you would actually consider to be somewhat rather ridiculous? Because I know I've been hearing all kind of stuff like they're microchipping people. The conspiracy theories start to come around when the vaccines start to come out.
Right. Yeah. So some of the concerns I've heard is like, man, it just seems like this vaccine has been developed really quickly and it's not been adequately tested. And some are worried like it will cause COVID, or like that the symptoms, how I kind of described some really mild flu-like symptoms. They're like, well, maybe it's giving you COVID, or that'll make you sick. I've heard some people really concerned that it may death, or will alter their genome. It'll like get into their DNA because it is the RNA vaccine, which is not DNA. Anyway, so those are some of the concerns I've heard. And really, as far as a couple of people that have been like, have you heard how it will alter your genome and affect your DNA? That's just flat out not true.
It's not true.
So the DNA, which is like our body's blueprint of how to reproduce cells, like that is not at all brought into the process of this vaccine working. The DNA is kind of like a sacred, like a blueprint that in that safe part of the cell, the nucleus, and that's like not touched at all with the process of the vaccine. Really, it's the DNA is kept there in the nucleus, but the RNA is kind of like a Xerox copy of the blueprint DNA, I guess you could think of it like. And what the cell is delivering is like that kind of Xerox copy of like instructions for the cell to produce a protein for the body to raise. And so I guess that's one that's like, I'm like, nope, that's ridiculous. Like that's definitely not true that your genome will be altered by taking it.
I think there was like a guy working in a clinic, and I want to say it was Wisconsin or something like that, where he believed this. He believed that the vaccine will alter your DNA, will alter your whatever else is going on in there. And he, I guess these vaccines need to be kept very cold. He took them out of their cold storage and left them out on purpose And now he's being arrested for that because he believed these things. Which is crazy. But, I know a lot of people out there who feel like there is a legitimate reason to be hesitant taking this vaccine. I know some people kind of cite the swine flu vaccine that was given during the Ford administration. That ended up making some people sick some years later. There was the Tuskegee experiments, and things like that, especially for people of color. What are your feelings about stuff like this? I mean, do you feel like these are legitimate concerns, or do you feel like, hey, vaccines, it's the reason why we don't have a lot of huge viruses that we used to have anymore? Maybe we should give this a shot. What are your feelings on that as somebody who works, close with, in the medical field?
Yeah, I mean, I definitely sympathize with the kind of apprehension, or kind of people raising their eyebrows, man, that really came to production quick. I guess one thing that as I've looked into it has helped me to feel really reassured and confident in going in to get my vaccine and to recommend it to others that I'm caring for when it's available to them, is that although this specific COVID vaccine has been developed in under a year, the platforms for it being delivered with specifically the technology surrounding the RNA type vaccine,
right,
that has been researched and studied for decade or more, and so the platforms of it have been rigorously tested and found to be safe. Really, the reason that has been looked into, or a reason that that's been being developed, is exactly for a scenario like this, where there's something new that comes up, a new virus, a new biological threat to society that we need a quick response on. And so that portion of identifying what is specific virus and incorporating information about that virus into the broader platform that's been developed, that was able to happen quite quickly, and I feel really confident in the safety of that. And of course, I do sympathize with people who are like, man, I just don't feel like we have enough info.
Right.
Nobody's had this virus or this vaccine in them for more than a few months now,
right,
so
right.
We can't know. But again, those platforms and the type of vaccine has been more studied over a longer period of time.
Mm-hmm.
And when you weigh kind of what is the risk of getting vaccinated versus not getting vaccinated,
they're not
even comparable.
Right. The risk,
yeah.
Herd immunity, which a lot of people are kind of saying, well, that should be the solution, is everybody should get it first, or the majority of the population should catch this disease, and that's how we can get through it. I've been reading through a lot of medical professionals that getting vaccinated is way safer than, going through the process of trying to infect everybody with the virus, especially because viruses mutate in that way. And I think knowing how viruses and vaccines work and being educated on it can kind of help quell some of the suspicions that a lot of people have on it, which is great, which is why I'm happy we have you on, because it seems like you are educated in this process. So thank you so much for that. But let me ask you this. I got just two more questions to ask you here. Why do you think other countries like New Zealand and Vietnam and South Korea and all these other places, they were kind of able to really curb this virus without having to go through the vaccination process first? I mean, I was looking at Wuhan, China, and they were having a huge party with each other the other day, and this is where that virus came from. Why do you think they were able to do that there, as opposed and able to curb the virus without having the vaccine there, where versus here in the United States, we're getting hit with record numbers of infections and death?
Yeah, so that's a great question. And I have some ideas to it. I'm not sure that that's my total area of expertise, on a epidemiological or policies level,
right.
To my specific area is kind of more focused in on on like kind of the one-on-one interactions and dealing with patients, but I can. It seemed to me like I just kind of wanted to give that as a disclaimer of not claiming expertise that I don't actually have, but it certainly does seem to me that a more centralized like leadership on how we're going to approach this, and I feel like this is like so many things in our country become so quickly polarized and divisive, and that there's like kind of two different pools of water that people are swimming in as far as like their ideas and thoughts of about what is truth and what is reality. And I think there definitely has been divisiveness on this one, and lack of really, I guess, uniform or not, like united kind of.
I was actually said this a couple weeks ago. Like, we're not all on the same page. Okay. We're not all on the same page when it comes to this virus.
Right. Yeah. Yep. And so I have to think that has contributed. If we were able to early on take it pretty seriously as a group before it spread, then it's a lot easier to contain something before it spreads. But the more it spreads, the harder it becomes to contain. So,
right.
Yeah, definitely.
Yeah, I completely agree with that. Even though I'm no expert either, but that would seem to be like the logical explanation to me as well. Absolutely. So, Anne, I have one last question. I'm sorry. Go ahead.
Oh, I was just curious. It sounds like you've done, you may have done even more research than I had into like those other countries specifically and like what their approach has been. Do you have insight have you, or what do you think? Oh yeah,
definitely. I've been doing my research on that really from the beginning of this whole thing, just because, just to see how other countries handled it versus us. Like in South Korea, for example, they got we got our first cases on the same exact day. The United States and South Korea, and they were able, they took it very serious from the beginning, and they all moved as one unit. They were pretty much on the same page when it came to how to mitigate it and what to do about it. And they were able to flush a lot of the virus out. Same thing in New Zealand. In New Zealand, they were, they went down to, they didn't have a case for weeks and weeks and weeks. And I think South Korea is still under 200 deaths or something like that. So their way of doing it was a lot different, and it pretty much coincided with what you just said. It was when everybody, like you said, people swimming in two different pools of water versus everybody kind of being on the same page and everybody having the same goal, which is to mitigate the virus and make sure we don't completely collapse. So yeah, and I've been doing my research on that, and it's pretty staggering. The difference in response. But let me ask you this one last question here. As a medical professional, what's the one thing you would advise people on with regards to this virus as well as the vaccine?
Yeah. Well, I think it's really taken a toll in so many ways, like health-wise, psychologically, financially, like, and on for it. And it impacted each individual uniquely, like this past year. And I think one thing we can all probably agree on is like to return to some semblance of normalcy again as soon as possible. And so I would just really encourage people to use all the tools that are like available to us to help bring that to pass. So I think the vaccine is like probably the most important one of these, and it's not available to everybody yet, but it in coming months should be. I would just add my voice of confidence to those who have said like this is a safe vaccine to get. It is an effective vaccine. I mean, it's like over 90% effective, meaning it can prevent like 90% of cases. And so and the more people that we can get vaccinated, like the less chance that this virus will have to spread from person to person and keep on disrupting our lives. So I would just encourage people to get the vaccine when available, and until it is available to them, to just also use, and even after, but
right.
to utilize the other measures are available to us, such as like the mask wearing, the social distancing, the hand washing, and just cutting back on continuing, as hard as it is, to cut back on like unnecessary movement around and so
yeah, everybody stop having your house parties. But anyway, that's the way I look at it.
Yeah.
But anyway, Anne, thank you so much. I really appreciate you taking the time to come here and to educate us on this. I know you gave me a lot of insight right now. And thank you so much. As somebody who's taken the vaccine, who's kind of, you're on the front lines out there in the healthcare industry. So we take our hat out to you for that. And thank you so much for coming on the USA podcast and giving us this information. I really, really appreciate it. Thank you.
My pleasure. Thanks for giving me an opportunity. Nice to talk with you.
Absolutely. You as well. All right, y'all. And there you go. You heard it straight from somebody who's out there on the front lines. Thank you so much. And y'all stay tuned right here. This is the USA podcast right here on the Young Angels Network. I'll be right back. You are listening to the Uninformed States of America podcast with your host, Mike Riley, here on the Young Angels Network. Follow us by going to youngangelsnetwork.org, MikeRileyNow.com, and the USAPodcast.com.